Hi, my name is Matthew Barrett. I'm one of the consultant cardiologists working in St. Michael's Hospital and with the Heartbeat Trust. I have a special interest in heart failure and advanced imaging of heart function to establish best treatments for heart failure and to guide therapy for patients experiencing heart failure. The term heart failure can sound very frightening. It's a slightly dated term from a long time ago when problems with the heart were generally only diagnosed when people were very sick. In reality, nowadays what we term as heart failure can range from very mild and quite well to a bit more serious and requiring a little more attention. It's very common, and up to 1 in 5 people will develop heart failure at some point during their lifetime. What heart failure means is that your heart is not working as well as it should and needs tests to figure out why it's not working as well. And this may involve some treatments to help improve its function. Think of your heart as the pumping of the blood around your body. Between heartbeats, the heart relaxes and fills with blood, getting ready for the next heartbeat. To work at its best, the heart must be able to both pump effectively and relax properly. When there is heart failure, there may be a problem with either the pumping or the relaxing action of the heart. These are the two most basic forms of heart failure: a failure to pump properly, which is a weakened heart, or to relax properly, which is a stiffened heart. Difficulties with pumping or relaxing puts more stress on the heart, especially when you're active, and require the heart to work a little harder. For example, if you're walking, taking exercise, or going up the stairs. The main symptoms are breathlessness and fatigue with activity. This can develop quite gradually over time. Additionally, as a result of the heart not working properly, blood can back up as it tries to move around your body, and this may present itself as swelling in the ankles or even a fluid buildup in the lungs that makes people breathless when lying flat and sometimes makes them use an extra pillow or two at night to keep their breathing comfortable. If you notice that you are less able to do your usual activities like going to the shops or out for a walk, you should contact your doctor. You may even notice that you are merely holding yourself back a little more than usual or perhaps slowing down a little bit to avoid getting breathless. This does not mean that you have heart failure, but you should get checked out. We are all more at risk for heart failure as we get older, simply because the heart pump becomes less efficient with wear and tear over time. Common conditions associated with an increased risk of developing heart failure are things which can injure the heart muscle directly, such as, for example, a prior heart attack, or things which make the heart work harder over time, such as high blood pressure, diabetes, and problems with some of the heart valves. The symptoms described above can reduce the quality of a person's life, and it is known to shorten life expectancy, particularly if not diagnosed and treated appropriately. As with any illness, it will present challenges. A person can live well with heart failure once they know and understand the condition and treatments and follow the advice from healthcare professionals. Once diagnosed, heart failure is a long-standing condition that, in general, cannot be cured but can be managed. Medication is the main form of therapy. A healthy lifestyle is also really important. Sometimes specific treatments or procedures may be used. For example, if one or more of the blood vessels supplying the heart with blood are narrowed or blocked, a stent procedure or bypass surgery may be performed. Sometimes, other procedures such as pacemakers or valve surgeries may be considered to help the efficiency of the heart. Given that heart failure, once it develops, usually requires lifetime supervision, the STOP-HF unit aims to reduce the number of people who develop heart failure in the first place by trying to prevent it from ever developing. Prevention is still the very best strategy. Heart failure often develops slowly over time, and sometimes, when symptoms start to emerge, the heart has already lost some of its efficiency and developed a degree of heart failure. The STOP-HF service is designed to monitor patients at risk of developing heart failure by measuring heart efficiency, even in individuals who feel well, to see if they can identify subtle evidence of stress on the heart before it becomes more serious. A patient's risk is monitored and steps are taken to slow down or completely prevent the development of heart failure. These steps include using up-to-date medications and tightly controlling conditions such as high blood pressure and diabetes, which can cause development of heart failure if not managed properly. In the STOP-HF service, we are committed to continually developing new approaches to heart failure prevention through ongoing research which is enabled by your participation. Together, we can help prevent or at least delay the onset of heart failure not only in the Stop HF community here in Ireland, but also around the world. If you would like further information on heart failure and our efforts to prevent this condition, join our regular webinars. Further information is also available on Heartbeat Trust's website.